All right, so George is a 54-year-old male with a current diagnosis of hypertension and type 2 diabetes. The patient was diagnosed with hypertension at age 52. The patient is also currently dealing with a cold. The patient is 5'9", 170 pounds, and has a BMI of 25.2. The patient has no recent weight changes. The patient's most recent blood pressure was 168/96, and the patient is currently taking metoprolol succinate daily for his hypertension and metformin twice a day for treatment of his type 2 diabetes. Currently, the patient's glucose levels are high, and he also has a high A1C level of 6.8%, which will still classify this patient as a type 2 diabetic. The patient states that he only takes his blood pressure medication when he thinks his blood pressure level is high. The patient is currently experiencing exercise intolerance and fatigue, and the patient is currently unemployed and lives with his girlfriend. The patient is actively job searching at the moment. Currently, he only eats limited fruits and vegetables, and usually eats traditional Hispanic foods like flour tortillas, refried beans, rice, and beef. The patient has no known food allergies. He drinks 2 to 3 beers 3 to 4 nights per week, and he drinks 2 cups of coffee per day. The patient also walks for 30 minutes 1 to 2 days per week. And for his nutrition diagnosis PES statement, it would be a nutrition-related knowledge deficit related to inappropriate medication adherence and dietary habits for managing hypertension and type 2 diabetes, as evidenced by self-report of only taking blood pressure medication when symptoms arise, elevated blood glucose, and a high A1C of 6.8%. So for our intervention, I will be using the Harvard Healthy Eating Plate, which really emphasizes eating a well-balanced plate, and it's similar to the My Plate resource, but also incorporates drinking water and including some healthy fats. So with keeping this in mind, some goals for George would be to, lower blood pressure and stabilize blood glucose levels, improve overall dietary quality with culturally tailored suggestions, so swapping out maybe corn tortillas for those flour tortillas, and to increase medication compliance, so he's not just taking his blood pressure medication whenever he feels like it. So our main priorities, I would like for George to increase his intake of fiber-rich foods, fruits, veggies, beans, legumes. Substitute lower glycemic carbs for, maybe like I said, those flour tortillas, so we could do corn tortillas or brown rice instead of white rice. Try to reduce his alcohol intake to less than 2 drinks per week. I would also like to encourage consistent meal timing to manage his blood glucose, and educate on the importance of taking his blood pressure medication consistently. Some more goals would be for him to eat at least 1 serving of vegetables with lunch and dinner 5 days a week. Replace those flour tortillas with corn tortillas for at least 4 meals a week. Limit alcohol to 2 drinks a week for the next 4 weeks, and take the blood pressure medication daily for the next 30 days, regardless of his symptoms. Some cultural things to keep in mind are those traditional foods, so respecting George's preference for Hispanic cuisine by suggesting including modified foods rather than eliminating those staples, switching to low sodium refried beans and adding veggies to rice dishes so he can still keep what he likes, just a little different. And we'll consider economics, so since George is unemployed, we'll recommend some budget-friendly produce like frozen veggies, canned beans with no added salt. Also, we'll look at health equity and ensure that George has access to clear, non-judgmental guidance and resources like community programs, food banks, and culturally appropriate education that aligns with his care. And we'll also consider language and communication barriers. So if George is more comfortable in Spanish, this healthy eating plate can very easily be transferred to Spanish. And any other education materials should be available in his preferred language. And so for monitoring, I would like to monitor George's progress by having him keep a 3-day food log to see how the patient is kind of incorporating those strategies that were discussed. We would also be testing the patient's blood pressure, glucose levels, kind of see where he's at. And then additionally, just want to check in, see if what the patient is doing seems sustainable and manageable to him.